Hey, everybody, welcome back to the You're Not Broken podcast. Today, we're asking the question, what if frailty is optional? Something that I know a lot of people do not think about. So I have my good friend, Dr. Wright, double board certified orthopedic surgeon, old boys club extraordinaire. You broke into it decades ago and you're still going strong. Welcome to the You're Not Broken podcast.
So thrilled to be with you again.
Yay! Dude, Vonda and I met years ago in the era of doctors on social media. And we've walked, I mean, you have been doing this way longer than me, my dear. I bow down to you.
I think the first time I spent any digital time with you during COVID. During COVID, I did this virtual thing and all of us were just tiptoeing into this space. Maybe you were there a long time, but I had just read Estrogen Matters and it changed my life. I'm like, I've got to talk about this. So, and then you said, I don't know who you are, but okay, I'll come.
I was just happy to have any doctor, because I was still like early in the social media. I was like, am I going to get kicked out of this doctor club? There were no doctor podcasters. Well, there were doctor podcasters, but there were no urology doctor podcasters. Like
Well,
that
the
mattered, but it did in my brain.
They were like university podcasts, very straight, very, not that this is not straight, but you know what I mean? It was like,
This is not a straight podcast.
No, I know.
So tell me, orthopedic surgeons, do they care about women?
Many of them are married to women. There's some that are not married to women, but they're married.
What percentage, sorry, I'm interrupting. What percentage of current orthopedic surgeons are female?
Less than 6%.
Less than 6%.
Probably 6% at this point. Yes, we've arrived
6%.
When I trained, there were 3%, 6% currently now. I think a couple years ago, there were 17% in the internship class. So that was a huge spike. I don't know if that persisted the next year because we were all counting that year. All the orthopedic women were counting. But needless to say, somebody's thrown out there's going to take 100 years to reach critical mass, which
at
is
the current rate of growth of women in orthopedic surgery, it will take 100 years to make equality.
Yeah.
Good
Equality.
God.
I was gonna take critical mass, but equality,
What's critical mass mean?
It means that there are enough women around that you stop saying female surgeon. So
nice.
About 33%. Yeah, we stop having to make these distinctions all the time.
Yeah. Sweet. So what made you read Estrogen Matters during COVID?
I can't decide how I found it, but I first decided to get out of my suffering when perimenopause hit me like a brick house, right? So I went straight from, and I say straight, not quite straight, but postpartum into probably perimenopause because I had a baby at 40. And then by the time
that's the thing. It's not published, but I've talked to reproductive endocrinologists about this, gyns about this, and I'm like, there's a thing about the body's final last, here's enough to have a baby, and
I read that.
You read it? Have you? Is it a published paper?
I can't remember where I read it, but I'm like, why after an entire life of having been coupled and not having a baby did I manage to squeeze one out? No, I mean, I don't mind. I talk about this all the time. I was such an athlete. I never had regular periods. I was one of these amenorrheic people my whole life until, I tell this in the book, so I don't mind telling it. Finally, my body got it together. I squeezed out one egg. I had a healthy baby, thank goodness, at 40, right? And then breastfed for a year. And then I don't think I ever felt like myself again until this started happening. 47, even before it, 47, I thought my world was going to end. About 45, please don't laugh too loud and fall off your chair. I knew so little about what was going on. And I'm an aging researcher. I mean, I'm a musculoskeletal aging researcher. You would think I would have known. But for the first time in my life, Kelly, Dr. Casperson, I began having regular periods. And they were heavy like a river. And they might be 30 something one time, 28 the other time. But I thought to myself, oh my God, at this time in my life, 45, 46, I am finally a woman because I was in perimenopause and in hormonal chaos and my periods were haywire. but I was actually having them and heavy, like all the other girls I had ever talked to at school, right? I didn't realize that that was going on, but I learned very quickly because they were quickly accompanied by all the things, everything people experience: hot flashes, night sweat, brain fog, and I dealt with that. But then when I started having heart palpitations in the middle of the night and panic attacks, and I thought I was dying, because I don't do that. I'm a pretty level person. I can handle stress in the OR, right? So I call my cardiology friend and I'm like, Ricky, you have got to figure this out for me because my people die of heart disease. So he puts me on a stress test. Heart's fine, Vaughn. Nothing's wrong with you. Okay, so nothing's wrong with me, but what's up with my heart? Right? And then I've told you this before. My mind is the best part of me. It's a steel trap. I can remember a word on page. It's just the way my mind works, and I couldn't remember nouns. I'm like, give me that thing. Give me that thing that I need to grab the thing in the OR. And everybody's waiting for me to call in an absent because there's
Yep.
many things that can grab the thing. And I finally then was complaining about this one day to a nurse friend of mine. I lived in Atlanta at the time. We were sitting on our back porch in 197-degree weather. I don't know what we thought we were doing in a barbecue, two menopausal women. And she's like, a bunch of us girls call this doctor in Chicago and he'll give you hormones. Yeah, so we're calling the secret doctor in Chicago. We're living in Georgia because she couldn't find a doctor. So the nurses had gotten together and found this guy in Chicago. And I'm like, I don't know. I better figure out if those are safe because I had heard of the bullshit data. And so somehow I found Estrogen Matters. And I was on the way back home from a wedding, a long drive. I listened to it 8 hours straight. I'm like, my God, whoa, I need some of these now. So I listened to it again, and then I'm an underliner, and I bought the hard copy and I underlined it. And then I called the secret doctor in Chicago. I called secret doctor. He compounded a bunch of hormones for me because that's the best I could do at the time. I know. So that's so
Wow.
much more than you ask for, but that's kind of the basis of my story. And
No,
then
it's totally validating. Number one, for any perimenopausal person, because even though you're doing like longevity older people research, you're probably thinking like we all did, like menopause is age 70, not age 45, you know. And it also super validating to anybody who has the experience, which is way common, of like, I had a baby and then it was perimenopause. Like, it's the final push that I think is very poorly documented, but like, I think it's a thing. I think the ovary's like, here you go. And by the way, I've met your child. Your child was needed to be like, that
she
was
needed
manifest
the
destiny that
world
that
needed
person needed to
her.
exist on the planet.
Thank
Freaking
you.
cool kid.
Thank you.
After I met your kid, I was like, if I get 80% of that coolness for my kids, I'm doing a very, very good job.
You know what? I have full faith in your daughters. I
We're going
do.
to be
And I've
good.
only heard of them, not met them yet. Yes.
Yeah, not yet. But so, I mean, I think the other thing is like, dude, you are an academic trained, went to med school, orthopedic surgeon. It's not like you're not involved in what's happening in updates in medicine. And you had to go through like the freaking underground pathway to a doctor in Chicago to compound you a secret formulation. Like, if that was your challenge with your connectedness and you're like in the medical system, everybody else is F.
Well, and they are, and they still are, because I sometimes live in this bubble where I believe that people have heard until I have my Tuesday afternoon clinic and the 46-year-old woman is living this devastated life. And I say, have you ever thought about maybe you're in perimenopause? And she's never heard of it. Not
A
only
natural thing that occurs to 50% of the humans nobody has heard of.
they've never heard of, they might have heard of menopause, never thought about it, but definitely not perimenopause until I tell them. And we go down and you're probably not sleeping well. And I just guess at what she's experiencing. And 3.5 seconds later, she's crying.
I was just going to say, and then she
And
cries.
then she cries. And I mean,
Number
and
one, because she's got crazy hormones. But number two, somebody actually understands what she's going through and she thinks she was crazy.
she thought, I don't know what's going on. And so just when I think we're doing a great job, and you and I just sat before the FDA. We say this to each other all the time. 80 million women over 40. There's so much work to do.
So much work to do. I know we were talking about that today. We're like 80 million women over the age of 40, 1 million physicians to get educated, and not everybody's on Instagram. So it's like finding the we gotta find the people that aren't on Instagram and don't listen to podcasts, and that's why we write books, because people also read books that don't happen to be on Instagram. So tell me, let's jump into your book first before we go to the papers. Why write a book about bones and fragility, and like tell us what we don't know but we need to hear.
Yeah, so Unbreakable, which is the name of the book, which is
Best name ever.
great. I'm an orthopedic surgeon, right? It's part of what I do. Unbreakable is about bones. It has a lot about bones. And I do want to talk about bones because they're totally misunderstood. So you
Yeah.
and I are gonna help people really understand the miracle of bones. Unbreakable, the book, actually is my answer to two things. It's the first, in my opinion, longevity book from the point of view of a woman, because there's plenty of
Big.
longevity books from the point of view of the bros, and bless their hearts, it's not that theirs is wrong, but they probably did not consider the role of estrogen on the what I call the time bombs of aging, the hallmarks of aging, and the fact that there is natural aging and then there's post estrogen walking out the door aging, and it's not the same thing.
It's an
So
accelerated state of aging.
it is. It
I
is.
mean, with how much you and I, and people like us know now, it's insane that anybody actually questions the importance of hormones at this point. But we're like in it, right? But it's like when you look at the graphs of like, yeah, the mother nature, father time, ticking along, boom, menopause. It starts going fast for people who don't replace their hormones.
Exactly. And so I am so sad that it took me between 47 and I think I finally went on hormones at 50 to figure it out, because I lost 3 good years. Or maybe I would have started at 45 had I known, right? So I encouraged that decision really early on these years. Unbreakable covers longevity from the point of view of women. The book is full of stories of me, my patients, people who've done, gone through this and what they did about it. So it's that point of view, the longevity from the female point of view, the science of it. It's also a what to do now, right? That we're here. I think there are a lot of fabulous books about menopause. You wrote one, you wrote another one coming out soon. Um, and I know your second one extends beyond that, but I wanted to pick up because enough people were understanding what was happening in menopause. Now, what do I do? So, really, the second whole part of this book is just what I do. I mean, I'm still a practicing surgeon. I have this business called Precision Longevity where people come and have me make plans for them based on data, because my office is in this gorgeous metabolic lab place and I have all these toys testing. So I'm like, here's how you do it, because this is how I do it for people. But it has a couple surprising things, and then I will hop back to bone. Aging is not for sissies, Kelly. It is not a mamby-pamby activity. We have to be mentally resilient to get through this. So a chapter in the beginning talks about values and goal setting and perspective and setting yourself up to be able to take action. And then towards the end of the book, we talk about what is the next level of mental resilience. And during COVID, because I had more time and because I read the data that female doctors kill themselves more than men, and of the doctors that kill themselves, male orthopods kill themselves, I thought, holy cow, I've got to figure out how to build resilience in my peers. So I became trained in this system of how to build hardiness. And so we talk about that in the book, about how do we step into feeling in control? How do we make a commitment to ourselves? Because aging isn't for sissies. And how do we see the difficulties as challenges, not as oppression, right? So it's this mindset to go forward that I address. But I think that naming the book Unbreakable is like a double meaning, right? We're unbreakable and all these things. But because I'm a bone doctor, and here's what people believe about bones, Kelly, is that if they think about them in terms of, oh, my gorgeous bone structure, look at these cheekbones, which I really don't have, or look at my clavicles under this dress or something, right? Or, oh, my delicate wrists, my bones. They think about them like that. They think about them in terms of when
They're like
they're,
hangers to hang clothes on.
yeah, oh, you know what? They, they're just structural. Well, without bones, muscle's just heaping mass of quivering metabolic tissue. It's not attractive. Bones make muscle attractive. Or they think about them when they break. Those are the only three things people think about with bones. But the reality is, bones are dynamically remodeling, meaning every 10 years you get a new set of bones. We build, we take, we build, we take.
That's trippy.
It's amazing. And they're endocrine organs. They are master communicators, secreting hormones like osteocalcin that communicate with the whole body. And that makes sense to me because if we are intelligently designed, then if I want to communicate with the whole body, I'm going to do it through a system that's from the top of my head to the bottom of my pinky toe because that's the pathway. Why should I create a different pathway? It's amazing, and nobody knows that about bone. They
The
also
amount of people who think osteoporosis or osteopenia is a fixed state that's immutable and permanent, like, I thought that.
did you?
I
Because you're
did.
a urologist. There's
I went
no,
to medical school.
well,
Urology has one bone. It's not good when it breaks. It's an emergency.
yeah, I've heard you talk about that, actually. That's
I've
something.
done one. I've told this story on the podcast before, but I've done one co-surgery with an orthopedic surgeon. It's kind of infamous in our town for people who know. So a while ago now, somebody put a motorcycle coil, like automotive grade motorcycle coil, around their penis, and then left it there for a week or two. Yeah, and so like I called the fire department. I called the level 1 trauma center. A cancer guy was on call. That was worthless. And so I called ortho in because they have the diamond tip drill bits, which we needed to get the automotive grade steel coil from around this guy's penis. And so I'm like
My,
squirting water on it to like keep it cool to help protect the
did you put
penis.
a malleable retractor underneath to shield
It was
it?
too swollen. It was too swollen, but I was able to get like, what's the Vaseline gauze? Enough like under there to help protect it. And we ran out of diamond tip drill bits. Like, patient lost to follow up is the
My God.
short answer. But it's an infamous, the only ortho urology combo case
You
in
know, I'm going
recent
to tell you
history.
what's happening with that case. That orthopod went to the academy meeting, and he was sitting in the lobby of the hotel with 30 surgeons around him telling this story. And then those 30 surgeons went back to their cities. This story is I can't believe I haven't heard it before I met you. I mean, these ortho boys, I
You're like,
love
yes,
these
oh yeah,
guys.
that's my friend Kelly up
These
there.
Caspers. I love them, but they would have been telling this story, Kelly.
It's pretty crazy. The long story short is don't make love to an automotive grade motorcycle coil
Be too embarrassed to come
and
in.
then leave it on for 2 to 3 weeks afterwards. Yeah.
That's a good story. Well,
That's the moral of that.
is
That story is not in my book.
not, but you know what? I've often thought about writing a different kind of book to tell all the weird medical stories that we never process while we're doing them.
If only we would like write them down and remember them in our states of trauma. Okay, so what percentage, you know this data? If you don't, nobody does. What percentage of osteoporosis can be reversed if you work at it?
I don't think that study's ever been done because people ignore bones. Ignore them. We know that 40%.
We don't even know?
Hmm?
We don't even know? If I get diagnosed with osteoporosis today and I say I'm going to start eating right, exercising, jumping, I'll get on the hormones, what percentage of people like me will have reversed that in a year?
I don't know that data. Maybe I just don't know it. I don't think it exists. We know we can reverse osteopenia, but our frank osteoporosis minus 2.5 is a long haul, and you're not
I've
doing
seen
it
people
in a
do
year.
it though now. Like I was working out in a Marriott hotel gym. There's this woman there. This is like a month ago. We were recording my audiobook. And she's like, Dr. Casperson, blah, blah, blah. Thank you. She fell skiing, broke something, then got diagnosed with osteoporosis, changed her diet, started working out, got on the hormones. She's reversed her osteoporosis everywhere except for one bone that's
Well, what
still
does
reading
that mean? She's
osteoporosis.
gone from minus 2.5 to minus 2, or she's
I don't know.
beyond
I didn't
minus
look
1?
at it. This is a hotel gym conversation.
Look it up, because I would be so surprised if somebody has done that study.
You would
Because
think the physical therapists have done that study. Physical therapists who are listening, tell me. Well, because, like, what do you tell a person? Somebody comes into your office, they've got osteoporosis.
tell them, well,
What do
here's
you
what,
tell them? Just maybe we just start with, like, what lifestyle things
yeah,
should we be doing? Not only to prevent getting osteopenia and osteoporosis, but to help get stronger.
I'll give you these data. So, of all the things, we know that replacing estrogen, because here's what estrogen does to bone. So, in bone, I love this new microphone, but it's in my way with my talking hands. So, in bone, we have osteocytes that are pulling bone out. They're making it an acidic environment, which leaches out all the minerals your body needs to live. Osteoblasts are building the bone back. This is a dynamic balance when you have your estrogen, because estrogen helps control the osteoclast, which is a wild child. It's going to keep eating like Pac-Man, controls it. So it's homeostasis. Without estrogen, we are out of balance. We're breaking down more than we're building. So, without estrogen, menopause hormone therapy or hormone optimization, we're never going to stop that imbalance. So, if we want to rebuild the most, we consider that to the tune of 3 to 7% increase in bone density over about 2 years. That is if you put hormones on. You layer on top of that, let's add some weight training. There's a big range of lifting heavy. The Lift More study shows that even women with frank osteoporosis can lift heavy, meaning 5 reps, 5 sets. That was their protocol, I believe. Under supervision without cracking up and being injured.
Meaning by the end of 5 reps, 5 sets, you're toasted.
Yeah, 5 by the end of that set, 5 is to failure, meaning, and we can define that. So lifting heavy means lower reps, higher weights, such that my protocol is 4. But when people are ready. So the 4th rep is hard. You're just pushing that bench press up. The 5th rep, you can get it, but you're not doing 6, because if you're pushing that up, you're going to fail and one side is going to slip off, right? So that's what heavy means, and it's a situation you work up to.
So it's to near failure.
It's to near failure. You don't have to drop the weights off, but you can't do 6 reps. If your goal is 4, you can't do 6. You can gain, the data has a wide range, but according to Osteoporosis International, you can gain about 8.4% bone density back from lifting weights. So if you've got
Wow.
7%
That's
from
good.
AT, about 8% from weight training, and then the other things, right? If we believe in collagen, 1 to 2% a year from adding a collagen. A weighted vest, not great studies, 1 to 3% if you believe the very small studies. And weight-bearing exercise, 1 to 3%. So if you want the optimal bone building, and I didn't even talk about nutrition, you need
But
a
yeah, I
lot
was going to say protein and
of
vitamin D.
vitamin D, magnesium, little bitty minerals, micronutrients. You can build back a substantial amount percentage of bone density, but it really takes all things, not just one.
Yeah. Don't do one and see how you do and blah, blah,
Yeah,
blah.
layer them all up.
I mean, I think this is the argument against can we take hormones if we're not symptomatic? Because the big push after the WHI was symptomatic only. And it's like, and you said this at the FDA talk, is estrogen is FDA approved for the prevention of osteoporosis.
It sure is. And if we know from other data that I quoted that for optimal effect in your 70s, you need to take it for about 10 years. You can't just start it at 65. We should be starting this so you have this long run up of estrogen to prevent fracture. I frequently quippy, like tongue in cheek say, everybody can argue about everything when it comes to hormones, but you can't argue with my data, not my personal data, but the bone data. You can't argue with it. It's pretty clear, right? And
Yeah.
so,
And I mean, I think going back to you suffering in perimenopause, 10 years from now, we're going to be treating perimenopause. I don't want to say aggressively, but like just knowing what it is and educating women, because your biggest rate of bone loss is the 2 years before your period ends.
Yes.
And you don't know when your period's going to end.
And you don't feel it. You
And you
don't
can't
feel it.
feel it.
You can't feel your bones disintegrating. You cannot. You feel it when
How
they break.
Remind people, for those in the back, how awful is a hip fracture?
God, people. Number one, it's excruciating.
Excruciating.
Pain you've never felt before because the femur, I usually have a femur sitting around my office. I'm surprised I don't. It is the biggest friggin' bone. It is not unlike my forearm. This camera moves with me. It's not unlike my wrist. It's 40 millimeters across, right? It's got a thick cortex, which is the tree bark. It hurts when it breaks. It makes a sound. There's a big pop. And then as
Ugh.
the bone edges rub
The
together,
urologist makes a face like she never has before. Ugh.
I know, I'm so sorry. And then you wait till the orthopod to pull it out to length. That's no fun. And then, so it's painful. But here's the deal. The minute you hear the pop, you break your femur, you have a 30% chance of dying from the complications. So if you're weak, if you're not coming in a specimen of physical fitness,
Yeah,
you're frail anyway.
You're more frail. Yeah.
You're more frail, and you may already come in with chronic UTIs. You pointed out the other day to me, that's probably why they fell down. They got dizzy from their chronic UTIs, or they
They're
tripped over
rushing to
their
the
little dog.
bathroom from their urinary urgency.
Yeah.
Yeah.
So the minute you pop your femur, 30% chance of dying. Here's a bigger number. 50% of the time you will not return to pre-fall function, which means your family is going to be faced with the decision whether you get full-time help, which is more expensive than anybody can do, whether you move in with your children, which most people say, I don't want to be a bother to my children, or you move into a nursing home. I mean, those are no choices, in my opinion. But
No,
it's the
prevention
reality.
is the best medicine in this scenario.
It is, and data show that the addition of HRT can decrease the incidence of fractures by 30 to 50%. The WHI itself said 33%. So this is no joke prevention here. It's probably the clearest example of prevention we have. And yet,
the WHI data is fascinating because that's in women who did not have a diagnosis of osteoporosis and it decreased bone fracture. I thought it was 50%. Am I wrong? Somewhere between 30 and 50%. But yeah, that's in people who didn't have a diagnosis of
amazing
osteoporosis.
Yeah. Well, and that's the other thing, right? We get diagnosed with osteoporosis, maybe when you fracture. Not all hospitals have a hip fracture protocol where you go get a DEXA scan, blah, blah, blah. Not all hospitals, you would think, but no. Or you turn 65 and finally someone will order it for you. So we don't even diagnose this most of the time.
Well, I think this is interesting. In America, estrogen is not FDA approved for the treatment of osteoporosis. And that'll be people's argument. I can't go on hormones because I already have osteoporosis. But it is government approved for treatment of osteoporosis in the UK and in other countries.
Yeah, we're just behind.
Right. And there is data in giving hormones to people with osteoporosis that it does improve bone density. Plus, my other argument is like, just because you have osteoporosis in your left hip, you don't have it in your radius yet. Like, protect that bone, right?
Yeah.
Osteoporosis doesn't mean all 206 bones
are bad. No.
Are
And
sand.
the ones we really care about is our lumbar and thoracic, lumbar spine, hips, and thoracic spine. Mainly, right? Because those are the devastating ones that take your life.
Well, I don't want to break my radius either.
Well, no, you don't. That's a
personal preference.
That's a 3-month hassle for you, but it's not a deadly challenge. But
fair enough. A radius fracture won't kill me. I remember my grandma, though. She had bilateral wrist fractures because she fell on the stairs.
What do? You can't take care of yourself for 3 months.
You can't wipe your butt.
Right? You cannot. It's demoralizing from a fracture. Yeah, demoralizing.
Totally.
Yeah.
Let's talk about musculoskeletal syndrome and menopause.
Let's do it. So,
what year did that come out?
This is the last year, this month.
2024.
Yeah. It's the anniversary. 30th of July is the anniversary of this paper.
Do a big social media push up about that.
I will.
I bet you will.
That paper has been downloaded more than 400,000 times.
400,000 downloads for that paper?
I'm going to put it in context for your people. Nope, I looked it up because I'm a little competitive. When my medical student called me and he's like, this paper has been downloaded more than any paper in the history of the journal. I'm like, no.
Nice.
Yeah. climacteric. So
Oh,
the
so it's open access. Anybody can read it. It's free
anyone
online.
paid the money to make it open access, $5,000, meaning it's not going to pay well because it was important, right? And I'll get to the paper, but the best papers in the best journals, British Medical Journal, Lancet, JAMA, are downloaded 10,000 times to put it in context. And 50% of all research is only read by the authors that submit it. So
50% of published research is only read by the author who submits it.
yeah, according to the internet. Yes. So that
That's
puts this in
embarrassing.
context. So when I finally recognized what was going on, which was not as ancient history I would have wanted to be, and women who come to my office, it's been many years now, but it's not been 20 years. It's not been 10 years. I noticed the same pattern. They were complaining that their arms didn't move. They had frozen shoulder, that their total body hurt, and they may or may not have been diagnosed with fibromyalgia. I'm like, why is every 45-year-old woman suddenly being diagnosed with fibromyalgia? Why do women after 50 have so much more arthritis than men after 50 when before 50 men have more? I already knew about osteoporosis. I already knew about the loss of muscle. Why do our stem cells go down? All these things. And I started just being the curious person I am and looking everything up. We have known about the osteoporosis of menopause for 30 years. It's been described in the literature. We have known for about frozen shoulder forever, and the Sentinel paper on it was written in 2011. And the conclusion said, this seems to happen in midlife women. We should evaluate the correlative factors, blah, blah, blah. I mean, like, figure it out, people. And everybody's lost their estrogen. But and so I started going down the road. I'm like, estrogen receptors, alpha and beta, are on every musculoskeletal tissue. So why would we think when estrogen walks out the door that all the musculoskeletal tissue wouldn't be affected by the starvation of this critical hormone that keeps the whole thing healthy? And then a few months before, 6 months before, Rachel Rubin and her group had written the paper, The Genitourinary Syndrome of Menopause, and that nomenclature had caught on. And so it sparked to me. I'm like, if I create a nomenclature so women can go talk to their doctors and not have to say, my shoulder hurts, my body hurts, my back hurts, my knee hurts, which is going to make a bunch of orthopods a little crazy, but they have a
All these things hurt
nomenclature.
and there's nothing to operate on.
Right. Sorry, nothing's wrong with you. And you know what? 41% of the time when radiology is done, there isn't a structural damage because it's a hormonal problem, right? We did it to give a nomenclature, to increase communication, to help women know they were not crazy, because that's what they say to me. Doc, I think I'm falling apart. I don't know what happened. One day I'm fine. The next minute, everything hurts. I think I'm falling apart. But you know what? I think I'm going crazy because I've been told nothing's wrong with me, but I couldn't take it anymore. And then they stop and say, but you know what? I have a really high pain tolerance, as if they're begging me to believe them. They're begging me to believe them and not blow them off like they've been blown off. So that's why we wrote that paper. And the fact that it's been downloaded more than 400,000 times does not mean that I wrote God's gift to papers. What it means, although it's a good paper, what it means is the need is so great, Kelly. The need is so great out there.
The
That's
need's
what it is.
incredibly huge. Like, we just quote the numbers and it's just like silence is like, if 80 million women over the age of 40, they've all got, am I saying 206 bones? That's right.
206, yes.
206. They haven't discovered a new bone since I graduated from medical school.
That's yesterday.
Pluto's not a planet anymore, so there might be
know.
a new bone. I got to check in every once in a while.
We could
I mean,
make one bone, two bones, but
yeah. Take your estrogen so you don't make one bone and another bone. So you have 207 bones. Women who take hormones have less osteoarthritis. Women who take hormones have less frozen shoulder. And I read a crazy paper a while ago that about 50% of women diagnosed with rheumatoid arthritis in midlife is a false positive. They don't actually have rheumatoid arthritis. It's an overdiagnosis of something they don't have.
It's like fibromyalgia. They come in a total body pain. The first thing people think of is polymyalgia rheumatica. They draw all these rheumatic labs.
And they all come back borderline.
They're borderline or negative. And then, well, we got to fit you in somewhere. Let's make you seronegative rheumatoid or something.
Rheumatoid arthritis.
saying that that is not a real diagnosis. Rheumatology is built on this, but I'm saying that can we be a little bit more curious and consider that maybe some of this pain is due to estrogen start deprivation and start a woman on life-saving menopause hormone therapy, bone saving, I should say, pain saving. It is life-saving. It infers a 30 to 40% decrease in all-cause mortality. But from the musculoskeletal system, can we try that before we put you on methotrexate?
We'll talk about risk benefits of medications, right? People are so like, air quote freaked out about hormones. And I'm like, oh yeah, like methotrexate is benign and let alone the osteoporosis medications.
Oh,
Right?
right.
Like, what do the orthopedic surgeons say? Like, right now, it's like they don't recommend being on them for more than 5 to 7 years
I
because
mean,
of the risk of atypical femur fracture?
because the category, the bisphosphonates, for instance, so remember how bones work. They break down and they build. It's dynamic. We never have too much or too little, hopefully, because it's dynamic. The bisphosphonates prevent the remodeling. So you keep building bone. It's because what matters is not only amount of bone, but quality of bone, right? So when you have a femur, when you're looking at a femur fracture or a femur, it looks like this, people. If you're listening, it looks like a little cane, a hook, like a pistol. It looks like a pistol handle and whatever. You can't see it if you're listening, but you can see the stress lines in the femur because our bodies lay down bone along the lines of stress. Because every step you take, believe it or not, you're bending the bone a little bit, right? That's just the way bones are. You think they're hard, but they actually give. And so it's that giveability, if you will. It's the ability to take the stress that really matters for fracture.
So the bisphosphonates will prevent bone breakdown, but you get a stiffer bone from it?
You get a stiffer bone. It's like
I think Estrogen Matters
outside.
handled that really well when they're like, it's not just density, because all DEXA is density.
That's right. So ultrasound, like you had one, I had one. We had a REM scan, right? To look at should I tell your medical history? I'm sorry if I said that, but you and I both had a REM scan and to look at the quality of our bone, which tells us the bendability.
Yeah. So this was in Australia when we were over there, and I got my hip and my spine ultrasounded, and he's like, it's showing low, like a light bone, like a less dense bone, but it's a very strong bone.
Yes.
Right. And then I came over to America and I got a DEXA scan where all it shows is density. And I got diagnosed with osteopenia.
Yes.
Which my understanding is it's kind of a made up term because they had to put something between normal and osteoporosis.
Yeah, it's -1 standard deviation below the
Yeah.
curve. You know
But
what? I
in
feel about
perimenopause, many people with osteopenia still have very strong bone. It's just not as dense. So DEXAs aren't perfect. And Dr. Avram Blooming said, the best way to evaluate strength of a bone is to put it in a vise and break it and see at which force it breaks. But that's a bad idea.
we do it in the lab. We have a robot that does that. But
God,
then what are we going to do with you? Put you in a
put me in a vise. No, thank you. Hey, do you think, I'm going to put you on the spot, do you think we have enough data yet for you to do a second musculoskeletal syndrome of menopause paper, but have it be focused on testosterone?
well, we got a good paper today that we're excited about. I haven't seen enough papers to say, I mean, I've seen 5 or 6. I don't know that we have 40 papers on musculoskeletal. Not that you need 40, but you need more than 5 or 6.
Yeah. I mean, I think so. Testosterone works on the osteoblasts, so it helps build. And new paper just out today looking at, this was a retrospective chart analysis, but it was people who've been prescribed
Charts, though.
like 1 million people in each, or 500,000 in each group. So it's decently big. Anybody who'd had testosterone for at least 3 months versus people who'd had no testosterone, both male and female, women had a 50% decrease risk of hip fracture in the testosterone group. And I think more and more, and going along with your book, of like, this is frailty prevention.
Yes, right. Well,
And there's no age cutoff. Not that there's any age cutoff for any hormone at this point. Age is a made up a thing to tell you if you can vote or not, and if you can get Medicare or not. But to me, I'm like, stop.
biologically, yeah, that's a good one.
But biologically, like, no, we're all on different clocks, right? But testosterone doesn't have, the age risk fear, I would say, that traditional estradiol does. That's a whole nother podcast. But it's like looking at frailty. I mean, there's a paper looking at the JAMA paper that just came out. This is another. I'm like literally going to write this testosterone musculoskeletal syndrome paper with you. So JAMA article that just came out 2025 looking at testosterone versus placebo post hip fracture. It was a negative study if you only read the abstract, because what their end was how far you can walk in a 6-minute walk test. So it was regular rehab in testosterone versus regular rehab in placebo after a hip fracture in women. And they didn't walk any farther in 6 minutes than the women on placebo. So negative study by what they picked as their
Their
endpoint. But
endpoint.
any testosterone expert will tell you testosterone doesn't always make you walk farther. It's a certain amount of time. It's not where testosterone shines. Testosterone shines in core strength, right? And lean body mass. So if you look further down the paper, women on testosterone had a 50% less likely chance of needing a walker or a cane at 6 months.
Yes. Yes. Which is important.
Incredibly important. That's independence. And the theory being testosterone increases core strength, and that's why you can hold yourself upright without a cane or a walker. And that's been shown before, like with MRI studies where they actually MRI'd people's core strength on testosterone.
Well,
So
I think those are
me, I'm like, we're like, we're collecting testosterone data by fits and starts. We do not have what we have with estrogen.
Yeah, there's no organized series of studies, but this going back to the one that just came out today, my first reaction was, well, it was only 3 months and I don't know if they were checking testosterone levels. How do we know those women were even therapeutic, blah, blah, blah. But then when you get to the end and it's 50% decrease, like who cares? Because they prevent a fracture anyway. I mean, not who cares we didn't test levels, but it kind of negates my argument that if it hadn't been found to be significant, I could have said, well, maybe they didn't bring their levels up. It was only 3 months. Nothing happens in 3 months. But the fact that something did with a minimum of 3 months, that's very interesting.
Super interesting. Yeah, I got to dig into it more. But I mean, what we know with testosterone is serum levels don't always correlate to testosterone receptors and tissue penetration, right? Like, and so to me, I'm like, even if somebody was to argue it wasn't a good paper because we didn't check serum levels, then you can argue serum levels don't accurately represent end tissue organ testosterone concentration.
You know what I just thought? I have a group of people who come to me just for menopause. And in those women, I always draw their testosterone because I'm going to supplement it if it's low. But I don't commonly draw that in women with musculoskeletal syndrome of menopause. I think it might be because I know their estrogen's gone. So, I don't make judgments based on that. But maybe I should, because when men, look at me being when men come into my clinic and they have multiple joint pain and their tendons are all popping, and I very commonly say, we're going to check your testosterone. And they'll sometimes say, but you know what? I had that done and it's normal. To which I say, well, no, I don't say your name, but just because it falls within the normal, 350 is low for a man, right? So I explain to these men, well, it may be normal range, but you may have been 1,000 when you were 30 and you're 300 now. So in my own clinic, I readily test testosterone. Maybe I'm going to start doing that for women.
Testosterone is important because testosterone modulates pain. We know women have less pain when they get testosterone supplemented. And so I'm like, that's also fits into the musculoskeletal syndrome of menopause, and your experience of it is testosterone is anti-inflammatory also, and it helps modulate pain and make things less painful.
So let me ask you this. So, if an 86-year-old came in and heard all these podcasts, I liberally give my mother vaginal estrogen, right? I don't care what age she is, right?
Yeah.
Now I'm thinking, she's out there walking around our pool with her little 6-pound weights, trying to stay strong. She's doing everything she hears me say because she was very frail. She almost died of heart problems. So she's come back from that. I'm now sitting here thinking, there's no age limit. Why haven't I offered this woman some testosterone cream? Am I going to damage my 86-year-old mother? What are your thoughts? Because you know more about testosterone than me.
No, I mean, I've put any aged human on testosterone who wants it. I mean, testosterone in women is still pretty woo, right? Like once we get an FDA, when we get an FDA approved female dose testosterone, it will explode this conversation.
I
So we're
bet.
just having this conversation early, right? But when we get an FDA approved dose for testosterone, is it going to have an age limit on it? No,
Yeah, for everybody. Yeah.
unlikely, right? It'll hopefully be for hypogonadism. And I think the amount of frail people in this country compared to the amount of data we have on frail people is embarrassing. Like they're forgotten and we don't give a shit, probably because we've forgotten them and we don't give a
They're
shit.
old. It's not sexy.
But even for they're costing society billions of dollars in care.
No, I know
Shouldn't
that. I
shouldn't
know.
we care about getting them as functional as we can?
When you're a 30-year-old hotshot researcher wanting to change the world, it's a hard I mean, I could be totally wrong, 30-year-old hotshot researcher out there, but you know,
Are you
I'm gonna
speaking about your
study.
former self
No,
or your
no,
current
I never
medical
studied.
student?
I'm the aging researcher, remember? But I did study masters athletes, so maybe it's me. I didn't study frail people. I studied prime masters athletes. They just happened to be chronologically over 40.
Yeah, I think it's very interesting looking at the data, which again, there's minuscule data, which is shocking, on testosterone for joint repair, rotator cuff tears. Like, there's very compelling mice data, but like testosterone helps these joints recover. And I know people who've done high dose testosterone for shoulder injuries. I'm not advocating this. This is not medical advice.
It's off label,
This
but
is off label.
yeah.
But the fact that we're not researching that and like people are they get put out of a job for shoulder injuries. Why are we not looking at this? It's insane to me.
For orthopedic surgeons to pick up this mantle, the first questions that will have to be answered is those that affect surgery. Because, I mean, my research was not that interesting to my peers because I was not changing surgical technique. My hip research was, my nanoscope research is, but my aging research never was. So to answer these questions in the orthopedic literature, it'll have to be as related to total joint replacement, either recovery or implant stability. That's how I make the argument to young surgeons they should be interested in estrogen. I'm like, do you like operating on bones that are like butter? Do you like your perfectly placed, gorgeous X-ray implants failing and falling out or breaking the bone around them? So, you know what? But that's okay. We'll start with the
I would
surgical
think even
question.
like the sports med docs though, like the
The
non-surgeon ones of
non-operative
like
sports docs would be
the
great.
non-operative, like why are we looking at testosterone for joint rehab for sure? Let's go a little more woo since we're going there. Peptides. Peptides are hot right now.
They are. They are.
What's a peptide and why is it super hot in longevity and ortho and joint
So
world?
peptides are just a series of amino acids that form a compound. Your body makes peptides. GLP-1's a peptide.
GLP-1's a peptide?
So our body makes them, but what's hot right now, or besides GLP-1, are not necessarily what our body makes, but those that we think that can somehow augment processes. Like the one I ask for the most is BPC 157, which in rat and murine models has great effects on wound healing and recovery. And so with those kind of data, it becomes very big in performance arenas, like with athletes and the influencers, right? Athletes are influencers. So one guy tells another guy who tells the parents of these young athletes that want to emulate, and suddenly it's a thing. So I don't think we know enough, certainly enough, not enough for me to every day hand them out. So this is my approach. People come to me for precision longevity and they want to start with the woo woo, like peptides and all these things.
Yeah, hyperbaric oxygen chambers.
Yeah, all the things that could eventually be additive on two conditions. Number one, three conditions. Number one, you have totally optimized your health because people come into me wanting to start with longevity woo woo because they've read it or they've seen somebody, but their health is just fine. It's not optimized. Their labs are not okay. They don't have a regular program. And so my approach is you come to me with okay health. We're going to spend all the time it takes to develop the standards and optimize your health. Once you pass that threshold and everything's perfect, well, then I'm going to layer on the things that I do for my pro athletes that I've treated my whole life, which is a different kind of labs. It's a very fine detailed. I mean, the pro athletes, when I was in Pittsburgh, I ran this building where the hockey team was. They had everything taken care of them nutritionally from the moment they woke up to the minute they went to bed, everything, right? So then we'll slip into the performance things. Only when someone's in peak performance do I think my approach is to do the woo woo things. That's condition number 1 or 2. But the third condition is you have to be willing to accept, and in some things I do, research influenced or evidence influenced, not evidence based, right? Allopathic medicine, osteopathic medicine, traditional medicine is evidence based, right? We're going to do the studies before we make a decision. The reality is, even in current medical practice, we do a lot of off label. We use drugs for not what they're approved for, just commonly, right? And that's standard practice in longevity and certainly in biohacking, the other arm of this. The whole community is willing to accept evidence influenced, meaning we don't have the data. We have it in rats. It could work. We don't know. We really don't know safety data, but we're convinced enough. And so, I mean, everybody can choose.
Yeah,
But
well, I
you
think
can't
that's
choose your
important.
children.
I think it's important to say because I think people talk about that without saying that. And people are like, well, it's on this X, Y, and Z podcast. This must be what everybody's doing now. And then you go on the websites and the websites are like for research and animal purposes only.
Yes. Well, and
Right. And
here's
you're
the
like,
thing.
that's the like ethical website. It probably should say that on all the websites that are selling things that actually have not been tested on humans.
So even in the longevity world, I'm going to encourage people, if you're interested in that, to know who's treating you because almost anybody can hang a shingle. There are people out there who have a bachelor's degree in something and have decided that they're longevity experts. And maybe they have become that. I doubt it, but maybe they've become that, but with no formal medical education. And on the other hand of that, there are doctors, allopathic and osteopathic doctors like you and me, so with real medical degrees who are board certified in their fields, who have decided to go down a pathway of offering these evidence influence pathways, but to a doctor. There's a group of us called the longevity docs. I know a lot of them. To a doctor. I just had a series of them on my podcast. I have this conversation and they are all very clear with their patients. This is evidence influenced and they all approach it like I do because I go over this with them. How do you approach it? Blah, blah, blah. Optimization, performance. Then we'll get into the less proven things, but they all have the conversation with their patients. This is the best data we have from mice, from little worms. These are the best data we have
From petri dish to human in one step.
from not to bedside. And then the person gets to decide, but it's always clearly delineated.
Yeah, I mean, I think so much of this is just the human's desire for shortcuts and the human's desire to like have quick fixes. And it's like if you dial in diet, sleep, and exercise and no alcohol and hormones,
Yeah.
you're close to being there. Like it's profound what that looks like after a year.
Well, and when I say crazy on stage things like I went from menopause misery to midlife mastery, it's not because I tried some peptide. It's because I did the things that you just said. And it took about a year, right, to
Takes
reverse.
about a year. I
So,
remember when I really started on a workout program and I was so pissed at 3 months that like I wasn't noticing anything. But I'd finally like, I was just so, it was like when I started working out consistently after my kids and I was like, God, 3 months straight waking up to do this, nothing. And then at 6 months, you're like,
and
right? It's
somebody
like
else
you do
noticed it.
have to keep showing up and people simply don't have the patience for it.
Yeah, it's hard. I mean, we're
It's hard.
designed to
But
be
aging
fun,
is not for sissies. Is that what you said?
so not, right? It's a hard thing.
I love it. Well, I really appreciate you talking about peptides because I think people are very curious about them and they don't realize how untested they are and how incredibly effective the simple, boring crap is.
There's no magic pill. Sorry, guys.
There's no magic pill. Tell me about your second annual event in Orlando, Florida in November. Because
So
tickets are on sale now,
they
people.
are.
Get the
They
book
are.
Unbreakable and buy a ticket at the same time.
Those are the action items right now.
Those
Buy
are the
the
two
book.
action items.
Yeah, and then come to the Women's Health Conversations in Orlando. It's the second year in Orlando. I
That's right. This
start
is not your second year of doing events. It's the second
No,
year in
I
Orlando.
started this in 2012 with the knowledge that women make 80% of all the healthcare decisions in this country, and yet I find women don't understand their power in changing the health of themselves and who they love. So I started this, and this November 14th and 15th, Dr. Casperson, Dr. Mary Claire Haver, all the people that we love, that you see us on the internet with, are coming to teach women. And I've partnered with Disney this year. It's on Disney property. Our
Oh
VIP
my
is going to
God.
have fireworks on the lagoon. But most importantly, people like you, amazing master educators, people like me, are breaking down the science and delivering it in digestible ways, because I believe that when a woman is educated, she's going to make the right decision.
Yeah. I always say that. You sold out last year, so you're going to sell it this year. So
Listen, we
people should
sold out
buy
really
tickets.
quickly, and we're already selling quickly. So if you want a ticket, you better get it, because I can't.
Do you have to be a woman to be at this conference?
No. Oh
No.
my God. Anybody that knows a woman can come to this conference. In fact, this is new data, right? Or data you and I talk about, but not here yet. I mean, what is the percentage of midlife divorces that can be attributed to the menopause changes? And I think men need to know this.
Yeah. We don't have great data, but at least 50%. Some people say, some divorce lawyers tell me 100%. So it depends on who you talk to.
One
It's
thing,
not good.
it's
It's
one thing or
bleak.
the other. Yeah.
I mean, I'm totally like, I'm tooting your audience / my own horn. But when I got on stage at your first Orlando event in
Yes.
2024, they gave me a standing ovation
Before you opened your mouth,
before I opened my mouth.
they
I
love
was
some Callie Casperson. So listen,
I was floored. I'm like, I will come
yeah,
back and speak for Vonda anytime. That's a warm audience.
they are so. Listen, wasn't it high energy? Like everybody all day was like, "Oh my God, this is the best thing ever," and it is.
All I heard about that whole day was, because of you, I got on testosterone, and A, I got a new relationship. B, I can get off the floor with my grandkids. C, I've started businesses. Like, all day long, I got to hear those stories.
Isn't that refreshing?
It's awesome. I mean, I know we're not yelling into the ether. Like, what we do is
But listen,
profoundly important. You, my friend, Dr. Vonda Wright, are a thought leader, a pioneer, an advocate, tireless. And I'm very happy that you're my friend.
I couldn't be happier about it. I'm happy to be.
And you recorded the audiobook for Unbreakables, for audiobook lovers.
Yeah,
That's also going to be
that's
available.
for 8 hours.
8 hours. I know, it's a marathon. I've done it twice. Book release date,
August 26th. It's in
August
pre-order
26th.
now.
So pre-order now.
Pre-order
Get
now.
it.
Yep. Get your book. Come to the Women's Health Conversations and see us both on stage together.
The Orlando airport's a good airport.
It's easy. It's
Plug
so
for
easy.
that. Alaska Airlines flies there.
Easy for you.
I know. It's wonderful. All right, my friend. Thank you so much for coming on the podcast today. This was an excellent conversation. We talked about some things that we have not talked about before on this podcast. So thank you for this opportunity.
Good. I'll see you soon, my friend.
Thanks.